Have you ever wondered if the medications you're taking every day are still safe for you after turning 60? Most seniors don't realize that, as the body ages, certain drugs that once helped can quietly turn harmful. In fact, some of the most common medications prescribed to older adults can increase the risk of memory loss, falls, internal bleeding, or even serious long-term health issues. And many people are still taking them without warning. In this video, we'll reveal 7 medications that doctors say could be dangerous after age 60. We'll explain what these drugs are, why they become risky with age, and what safer alternatives might exist, all in clear, simple language meant for you or someone you love. If you're over 60 or care for someone who is, this information could protect your health and even save your life. Let's get started. Benzodiazepines. Benzodiazepines are medications often prescribed for anxiety, panic attacks, or insomnia. You might recognize names like diazepam, Valium, lorazepam, Ativan, or alprazolam, Xanax. While they may calm the nerves or help with sleep, they also slow down brain activity. In seniors, this can lead to serious side effects, such as confusion, dizziness, memory loss, and an increased risk of falls and fractures. Long-term use is especially risky, and in many cases, the withdrawal process can be difficult and must be done gradually. Doctors are now recommending that these medications be avoided or used only for the shortest time possible under close supervision. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs like ibuprofen, Advil, Motrin, and naproxen, Aleve, are common over-the-counter pain relievers. While effective at reducing pain and inflammation, they can cause stomach bleeding, kidney damage, and raise blood pressure, especially in seniors. If you've been using NSAIDs regularly for chronic pain or arthritis, your risk of gastrointestinal problems or kidney strain may be much higher than you think. Alternatives such as physical therapy, heat treatments, or safer medications may be more appropriate. Always consult your doctor before continuing NSAIDs long-term after 60. Anticholinergic medications. Anticholinergic drugs are used for a variety of issues, such as allergies, overactive bladder, depression, or motion sickness. Medications like diphenhydramine, Benadryl, oxybutynin, and some antidepressants fall into this category. These drugs block a neurotransmitter called acetylcholine, which is essential for memory and learning. In older adults, they can cause confusion, blurred vision, dry mouth, constipation, and even cognitive decline. Long-term use has been linked to a higher risk of dementia. If you're using any medication that causes sedation or fogginess, it's worth checking if it's anticholinergic and whether safer options are available. Sleep aids. Many seniors struggle with insomnia and turn to over-the-counter or prescription sleep aids like Zolpidem, Ambien, Sopiclone, Lunesta, or even nighttime cold medications. These drugs may help you fall asleep, but they often come with a price. In older adults, sleep aids can increase the risk of drowsiness during the day, falls during the night, memory issues, and even dependency. The way these medications are processed by the body changes with age, making their effects longer-lasting and sometimes unpredictable. Doctors now recommend behavioral changes and natural sleep strategies before turning to medications. Muscle relaxants. Muscle relaxants like cyclobenzaprine, Flexeril, are often prescribed for back pain, injuries, or spasms. While they may provide temporary relief, they act on the central nervous system and can cause drowsiness, dizziness, and confusion in seniors. The sedative effect increases the risk of falls, especially at night, and may worsen cognitive function in those already dealing with memory issues. These medications are generally considered inappropriate for older adults and are best avoided unless absolutely necessary and monitored closely by a healthcare provider. Certain diabetes medications, like glyburide. Some older diabetes medications, particularly glyburide and glimepiride, can cause low blood sugar, also known as hypoglycemia. In seniors, this condition can be especially dangerous, leading to fainting, confusion, and even falls. As we age, our kidneys may not clear the drug as efficiently, increasing the risk of prolonged low blood sugar episodes. Doctors now prefer safer alternatives that carry a lower risk of hypoglycemia, especially for older adults managing type 2 diabetes. If you're on one of these older medications, it may be time to ask your doctor about newer options. Proton pump inhibitors. Proton pump inhibitors like omeprazole, Prilosec, lansoprazole, Prevacid, and esomeprazole, Nexium, are used to treat acid reflux, GERD, or ulcers. While they're effective in reducing stomach acid, long-term use, especially beyond a few months, has been linked to problems in seniors. These include decreased calcium and magnesium absorption, increased risk of fractures, kidney issues, and even vitamin B12 deficiency. PPIs are sometimes used far longer than they were intended, simply because no one reevaluates the need. If you've been on a PPI for more than a few months, speak with your doctor about tapering off or switching to safer alternatives. So, just because a medication is common doesn't mean it's always safe, especially as we grow older. After 60, our bodies begin to process drugs differently. The kidneys and liver may slow down, making it harder to clear medications from the system. The brain becomes more sensitive, and side effects that once seemed minor can now become dangerous. But this isn't about scaring you or stopping your medications overnight. It's about having an honest conversation with your doctor. It's about reviewing what you're taking, understanding why you're taking it, and making sure it's still the best choice for your health today, not just what was prescribed years ago. A simple medication review once a year can make a huge difference. It can protect you from serious side effects, help you feel better, and even save your life. Always remember, never stop any medication without your doctor's advice. But don't be afraid to ask questions. Stay curious, stay informed, and most of all, stay in control of your own health journey. If this video helped you learn something valuable, give it a thumbs up, share it with someone you care about, and subscribe for more senior-focused health tips made just for you.